this Andaman Nicobar Island as a role model. I thank the organizer for giving me this opportunity and best wishes to all of you. Thank you very much. Jai Hind.
Thank you, Dr. Jaiswendra sir, for your inspiring words and for championing cross-sectoral research and innovation that benefits our island communities. Now I invite Dr. H.M. Siddharaju, Deputy Director, Director of Health Services, Andaman Nicobar Islands. Dr. Siddharaju has played a significant role in implementing public health initiatives, improving healthcare delivery mechanisms, and strengthening institutional capacity across the island regions. His proactive leadership has been crucial in advancing
Health, Animal Husbandry, Forestry and Fisheries Department. A very good morning to all of you. It gives me immense pleasure to be a part of this regional stakeholder meeting on the implementation of One Health approach here in Andaman Nicobar Island. I extend my sincere greetings to all the participants who have come all together with a shared vision to build an healthier communities through collaboration across human, animals, and environmental health sector. They are the three pillars of One Health approach, and as they are interlinked and interdependent. One Health concept is no longer a theoretical endeavor; it is a practical necessity. In today's interconnected world, where emerging, re-emerging zoonotic diseases threaten both human and animal population, a siloed approach is no longer sufficient. The Andaman Nicobar Island, with its unique topography, ecological diversity, far away from mainland India, and proximity to maritime route, and a tourist hub attracting national and international tourists, represent both a need and a challenge for implementing One Health strategy in this island. I must appreciate the director of RMRC, SPP, for taking this initiative to convene this regional meeting, bringing together experts and stakeholders from diverse fields. RMRC being an institute in health research, RMRC continued research activities in disease surveillance, antimicrobial resistant studies, and zoonotic diseases in especially in leptospirosis, has provided valuable recommendations and suggestions to guide our public health policies in this duty. Right now also, the leptospirosis is a major public health problem in Andaman Nicobar, sir. And right now we have some outbreak activities are happening in Diglipur, Mayabandar, and Rangat also. Cases are being referred in critical conditions and multi-organ failure situations. Still, it is a challenge for us. RMRC is being an Apex Institute, has a field workstation at Nicobar. I request Director RMRC to have a field workstation at Nicobar also, where it is an epicenter for leptospirosis. It will be an help for us and in handholding us in tackling these problems. And I appreciate the participation of scientists from CARI as director sir and his team. Sir, we look forward for your deliberations and suggestions also. That actually, health department always feel the pinch with respect to. I'm talking about leptospirosis and zoonosis in general, leptospirosis in particular. I will quote an example. I reported for duty in Digipur in 2019 when a 20-year-old boy who was studying in JNR college came to help his father during agricultural activity. And I joined my duty at 9 o'clock and we came at 10:30. Within half an hour, sir, with 2 bouts of blood vomiting, he coughed to blood and then he expired in half an hour. We were helpless. And you can imagine a family with a boy who is studying. He is the future of the family, and he had a mortality due to this disease. There are so many incidences, but health department always feel the brand. Though causal factors are many, multifactorial, maybe in agricultural, where the spirochete load may be there in the soil or with water, contaminated water, or the farmer who is doing his family is getting affected. So with this deliberation like this, a concrete a framework for tackling this will be helpful for us. I also appreciate the Director of Public Health and, from Tamil Nadu for coming here and sharing its insights and implementation in Tamil Nadu. And they are always they are the leaders and pioneers in implementing public health policies. And sir, we always look forward to you, sir. And also government of Tamil Nadu is kind enough to in handling us and in capacity building and training of our doctors in Tamil Nadu. And we look forward to your suggestions also, sir. And from Director of Health Service, we are deeply committed in strengthening collaborations with all concerned sectors, veterinary, agriculture, wildlife, and fisheries department to create a integrated surveillance and response mechanism. We envision a multi-sectoral coordination framework that not only detects and responds outbreak early, but also prevents them through sustained joint action and capacity building and also community awareness. I'm confident that today's deliberation will lead to actionable strategies in implementing One Health. In this duty, our participation can serve as a model for others also. So we will be the most benefited one, and it will be a learning experience for us also, sir. And once again, I thank. Together, we can build a resilient system where human, animal, and environment coexist with harmony. And once again, I thank Director Emerson for organizing this important platform and wish the meeting a great success. Let us move forward with a spirit of collaboration, innovation, and shared responsibility, a true essence of One Health. Thank you.
Thank you, sir, for your thoughtful remarks and for your continued efforts in building effective and accessible public health systems for the islands. With these distinguished leaders setting the tone for today's program, we now move forward with strengthened purpose and collective resolve. May I now invite Dr. N. Muruganandhan, Scientist E and Nodal Officer at ICMR RMRC Sri Vijayapuram, to deliver the session on overview and progress of One Health activities. Dr. N. Muruganandam is a distinguished public health researcher known for his extensive work in infectious disease surveillance, zoonotic disease research, and epidemiological studies in island ecosystems. Under his leadership, the One Health program in the Andaman and Nicobar Islands has strengthened cross-sector collaboration between human health, animal health, and environmental sectors. His initiatives include capacity building for integrated disease surveillance, facilitation of laboratory-based research on emerging pathogens, development of rapid response mechanisms, and fostering partnerships with academic veterinary and environmental institutions to address health threats in a coordinated manner. His contributions have been instrumental in establishing a comprehensive One Health ecosystem for the islands, enhancing early detection, prevention, and control of zoonotic and vector-borne diseases. So, we request you to kindly address the gathering.
Good morning to all the respected dignitaries from Tamil Nadu, Puducherry, and Andaman Nicobar Islands. Now we are going to have an overview of progress of One Health activities. So this National One Health Program for Prevention and Control of Zoonotic Diseases is a Government of India program led by National Center for Disease Control with the objective to build the capacity of the state on all technical aspects of zoonotic diseases, especially laboratory capacity building, surveillance activities, and joint outbreak investigation, and strengthening biosafety and biosecurity, and emergency response team, and all these were towards the zoonotic and foodborne threats. These are the key departments always associated with these One Health activities in the case of implementation of One Health program. ICMR and ICR has the joint research priorities, and the Ministry of Science and Technology makes the roadmap for all over the country. And National Disease, NDMA Disease Management Authority, and NCDC and the Emergency Medical Relief and the IHR Division, they play the outbreak response and the management of outbreaks, especially for exotic diseases. They make the plan, and FSSA has the always generating community awareness on eating habits of the people, and the National Disaster Management Authority and the Minister of Health preparing the preparation and implementation of action plans, which now associated with the disaster management team. They are making climate change related activities also. This recently there is one institute, National Institute of One Health in Nagpur. It is established by ICMR, but under the direct control of the Ministry of Health. It is the one going to lead all these One Health activities all over the countries. This institutional mechanism, though the NCD is the one which is coordinating, it cannot coordinate all over the country without the support of everyone. So they made a hierarchy system. They made a regional level coordinators. Right now, around 11 regional coordinators all over the country are there. It is going to be 18. In that 11, one is Andaman Nicobar Islands. Initially, we were having 5 different states. Now they have given 3 states. So once it will become 18, every regional coordinator will have 2 or 3 states under their coordination. Under that, different states are there. That is against each state has one nodal officer also. Each state has then again district level they are having coordination. So this hierarchy system they made it for coordinating this National One Health program. So main role of this coordination, especially data sharing, intersectoral coordination between each state and districts, and inventory maintenance. Resource mapping, inventory mapping, and IEC activities, and any sample is there. Which are the reference centers available for that? To that centers, you have to have the sample for confirmation. So referral activities, These are the main role of these coordinations. The one important thing is the capacity building. Capacity building is always a key role for this coordination activities. So under this capacity building, there are two different. One is joint orientation workshops for medical and veterinary and wildlife professionals. There are medical officers and veterinary officers as well as district forest officers plays a significant role, along with the state entomologists also. And hands-on training and lab diagnosis for laboratory professionals. This is the target audience: state medical and veterinary college and public health laboratories and the regional level laboratory officials all are involved here. Here, at least one training in the joint orientation level and two or more hands-on training it should be conducted, which is keep on happening in our center also. Next. So the strengthening activities for zoonotic diseases and data sharing, outbreak investigation, sentinel surveillance. It took place as a sentinel surveillance aside for all the state and the health sector regional coordination, where whatever the disease data available that should be uploaded in the IHIP portal. These all activities should be coordinated, but every state is doing perfectly. They are reducing our load. Next. So this regional center also will coordinate with the state coordinators, finding the state focal points. So the state action plan will be made for the prevention of the zoonotic disease will be made in coordination with the regional coordinators, and this state level coordinator will coordinate with the district level coordinators. So this each state level and district level they have their own agendas, which will be matching with the regional coordinators. So RMC code layer. This RMC code layer is one of the center, which is WHO-CC for the leptospirosis for Southeast Asian countries. Since leptospirosis is one of the important zoonotic diseases, we have the WHO-CC. We are also playing a crucial role in the country for controlling the leptospirosis, apart from other zoonotic diseases. This center has a diagnostic facility for all type of viruses, except certain exotic diseases, and we have all type of facilities. Keeping this view, we have been given this facility to us, this regional coordination to us. Next. So this center is supporting for this capacity building for diagnosis of leptospirosis in national level and international level for Southeast Asian countries as well as international. Every state we are being support for the capacity building, and we are involved in the outbreak investigation also. There are 3 states are connected with this coordination. One is Tamil Nadu, Puducherry, and Andaman Nicobar Islands. We have conducted various hands-on trainings and a regional coordination meeting. Our earlier director, one of the experts in the leptospirosis in the country, even Southeast Asian country, he also played a crucial role for control of the leptospirosis. So different activities has been conducted in different duration. In the hands-on, apart from hands-on training, we are also doing the webinars like webinars for different levels, and also next hands-on training to different state. We have last time we have been there in Puducherry. We conducted a hands-on training. There, majority of the participants were from Tamil Nadu and Puducherry. We trained for capacity building the leptospirosis diagnosis and characterization. We did it. Next. In addition, for creating awareness, we are going and giving awareness creation in different places: college level, rural level. Next, rural level. We are going to each panchayat level and next. School level, also competition, school level, different programs we are conducting, even on a big quiz program. And they are state of the Andaman Nicobar Islands school children have participated. So different activities we are doing. These are creating awareness among different level. Higher, who are the stakeholder level to children level, school children level, we are creating awareness as well as we are emphasizing the importance of the zoonotic disease control. So in Andaman Nicobar Islands, different islands are the entire islands wherever the population inhabited, everywhere we are going and creating awareness, including tribal population also wherever tribal possible Nicobar and certain area wherever possible we are going. And one is untouched, that is sentinel area. We go remaining population almost we are going and creating awareness to these populations. So our important role is that healthy people, healthy environment, healthy animals. With this, we will try to create our, we'll try to hand out each other, and always we record all the seniors who are the sitting in front of us. Extend your kind support for strengthening further this zoonotic disease control activities. Thank you.
Thank you, sir, for providing an insightful overview and for your continued leadership in advancing One Health preparedness and collaborative public health system. We now move to the session on current status of One Health implementation in Tamil Nadu. First, I invite Dr. A. Somasundram, Directorate of Public Health, Tamil Nadu. Dr. Somasundram is a distinguished public health leader who has contributed significantly to statewide health programs, disease control strategies, and multi-sectoral public health preparedness. Sir, the floor is yours.
Good morning. At the outset, I would like to thank the Director RMR for inviting us to this important topic of the day, or topic of the decade, you can say. And I'll also thank Dr. Murhanandam for his team's hospitality and all arrangements for accommodation and also for this meeting. And I thank Dr. Siddharaju, who is constantly associated with our team, Directorate team in Tamil Nadu. I'm going to take only 2 minutes because I have with me my additional director and the joint director. Due to the complexities in One Health, we are still evolving. We have a routine problem in all the states and so in India. There are many issues, and as everybody already mentioned, we are working in silos, and we are tuned and brought up in a similar way that we cannot coordinate. Even within health department, it is very difficult to manage with Director of Medical Services, Director of Public Health, particularly in Tamil Nadu, Director of Medical Education. We have a Director of Tamil Nadu Medical Service Corporation. All these complexities exist in silos, as well as when it comes to interdepartmental coordination within the health. Again, it is a challenge. Like what we have intra-species and interspecies complexities. That is the cause for human health. And there is One Health. Now, what we have, the status of Tamil Nadu with regard to One Health is, we have formulated a One Health steering committee under the chairmanship of our chief secretary with the 23 departmental IAS officers. And the next level is the state task force, which directly deals with the state action plan that we have drafted. We have formed the One Health hub under the health secretary. And the next is with the World Bank supported this hub. We have formulated certain indicators, disposable link indicators for the support of World Bank. Then we have we have been partnered with Andhra by Government of India for One Health app. This is the status, actual status. And after coming here, I can understand that we have a lot more problems. And after hearing from all the sessions, I think we have a great commitment, particularly when Dr. Muruganandam enumerated what is the levels of this Government of India, region centers, then state action plan, district. Particularly this state can coordinate with regional centers very well, and it has to make a commitment to work with RMRC and also with we have an NIE in Chennai, so they are continuously working with us. And also we have Tanuvas, Agricultural University, Veterinary University, all the departments have to collaborate, I understand. And we will surely collaborate with RMRC and we are looking forward to work with RMRC. And once again, all gathered here are welcome to Tamil Nadu because we have the one strength we have in Tamil Nadu is the public health unified cadre. That is unique in India, and we have a different public health system with nearly 50,300 staffs working in the department. So sometimes I imagine that if the public health department is not in Tamil Nadu, what Dr. Siddharaju and others told about Tamil Nadu would not have been existed. So we cannot imagine a public health separate system. It's necessary for each of the state, particularly when because the clinician who is working in Directorate of Medical Services, he cannot focus on certain public health activities. So the clinician who is working in a medical college, he has a dual role. He or she has a dual role, education as well as clinician. So again, they are compelled to do public health activities. Instead, you should develop a system where there should be a separate cadre in each and every state, union territory for tackling the future. Because now I can coin a word as one habitat. It is not one India, one health. It is one habitat because humans have encroached the forest and encroached the place where animals dwell. And now we blame it on animals. So that is the way we get new emerging diseases and re-emerging diseases. For example, Kerala, which was once God's own country, now it has been interfered with the four-lane system. Because they were the one who resisted this four-lane for a long time, but they could not succeed finally. It is the development, whether you need development or you need diversity or you need one health, it is always a challenge. So now after coming to Andaman, I can imagine after 100 years, all these islands will be connected by roads and people will start walking, talking, and then the species interaction will happen, interspecies will happen, and sometimes in the name of development we will spoil everything. So again, then One Health will be the talk of the centuries, many centuries. So this is what we said, we have to curtail both development and One Health. Only if we build as a twin brothers, then only we can succeed. This is my opinion, and my team will talk to you. Thank you.
Thank you, sir, for your valuable address. Next, I invite Dr. P. Sampath, Additional Director, Directorate of Public Health and Preventive Medicine, Tamil Nadu. Dr. Sampath has been instrumental in implementing integrated surveillance and strengthening state-level public health systems and interagency coordination. Sir, kindly share your views.
Good morning. First, I thank the organizer to organize the One Health Day, observe the One Health Day program. First, I thank the Director of Regional Medical Research Center, Andaman, as well as I thank the ICR, Agri, as well as our Deputy Director of Health Services, Andaman, and other state surveillance officer of Puducherry, and my colleague, Joint Director, as well as state surveillance officer of Tamil Nadu. The One Health, why we give more importance to One Health? The olden days, our public health taught us Older days, mostly all epidemic diseases are gram-negative bacterial organism. Mostly. Then later on, in our national health program, we tend to go back to our national health program. What is the first national health program implemented in our India? That is National Family Welfare Program. Next to that, the two diseases, that is social diseases like leprosy and TB. Then malaria as well as filaria. The first disease prevention and control program, that is first one is malaria 1953, followed by 1955, that is filaria program. Then 1972, there is national control program for tuberculosis. 1977, that is monitored plan for malaria program. And 1983, that is national leprosy eradication program. Likewise, the program day by day new program come. But later on that most outbreak diseases or epidemic diseases are mostly zoonotic origin. Then we come across, that is first one is in the year of 2009, that is swine flu. As you know, the first note is reported in Mexico, followed by entire world is affected. Later on, even this COVID, Middle East respiratory virus COVID, also reported in the Arabian countries. Later on, recently, the 2019 and 20, as we know that COVID, SARS-CoV-2. These are, go back, what is the cause for that? That is zoonotic origin. Mostly 2/3 of recent emerging disease as well as re-emerging disease are zoonotic origin. That's why we give more importance to One Health. Everyone, they work separately. Human health, they are concentrating on human health activities, human health control and prevention activities. Likewise, animal husbandry department, they are livestock and the economical of the community and the country. They are more concentrating more on animal health. Then another area is the food safety department. They are giving more importance to the storage and preservation. Like that, they are giving more importance to food safety. Later on, the environmental degradation is one of the challenge for this decade. As you know very well, environmental air pollution, soil pollution, water pollution, all pollutions related to environmental change, that is climate change. It affects the increase the vector indices as well as the vector density, thereby re-emerging diseases like Zika. The one vector is Aedes aegypti, there is one vector, it causes 3 diseases. As we know, that is dengue, chikungunya, even Zika recently we reported, and as well as the South African countries, that yellow fever also. The 4 diseases, the single vector transmitting carrying various virus, you know. Likewise, we have to give importance. This is a time to integrate and coordinate and collaborate and communicate all departments, human health as well as animal health, environmental health, agriculture, food safety and standard, so food safety department in the national, the country, the world level, the Food and Agriculture Organization and WHO and One Health Organization as well as all organizations, they are united and they formulate the plan, fight against how we are going to fight against one is the plan to mitigate the or counter the emerging as well as re-emerging disease. This is the time we have to integrate as well as coordinate, communicate. That is the first area one is surveillance. That is very, very important. In human health, we have from 2006 onwards, we are implemented, that is integrated disease surveillance project by Government of India. We now the integrated disease surveillance program started in the year of 2006. Only numbers in the year of 2020, we are live restricting cases wise. Even fever syndrome or cough syndrome or diarrhea syndrome, any jaundice syndrome or menstrual syndrome leading to death or acute enteritis syndrome, we are live listed. What could be the cause? What is we prioritize the pathogens. Based on that, we take measures that preventive as well as control measures. We are establishing the second area is capacity building. The recent days, the medical professionals from various government as well as private and international students who are not have enough knowledge about disease, newer diseases as well as older diseases. We have to train them because the European countries they won't get the tropical disease like TB, leprosy, or some what we talk about this vector-borne diseases, even leptospirosis, zoonotic diseases, or rabies. That's why you have to train them. As well as you have to establish diagnostic facilities because yearly the level of prevention, as we know, that primary prevention, secondary prevention, and tertiary prevention. In the this one health, we need primary prevention more strengthen. We strengthen the primary prevention activities as well as secondary prevention, that is early diagnosis and treatment. That is very, very important. Okay, then another one is research and development. The research and development we have to establish diagnostic kits sensitive. The kit should have the capacity, high sensitivity and specificity to detecting infection. What is the cause for that? Whether bacteria or virus or fungal or parasite. Like that, we have to detect simple and effective high sensitivity and specificity diagnostic facility. In Tamil Nadu, we established one state public lab. This is a lab integrated all vaccine preventable disease reference lab as well as leptospirosis reference lab. Then even the vector-borne diseases, the collecting the mosquito samples, we detect virus in the mosquito. That is especially dengue virus is there in the mosquito pool, Aedes mosquito pool, or JE virus. We are detecting regularly once in a month. We are collecting is allotted to the district entomologists to collect the mosquito. Thereby we are dissecting. We do RT-PCR testing. Then we detect whether the virus is present in the mosquito or not. We based on that we alert the system impending outbreak or for forecasting the outbreak. We are doing our system as the director mentioned. We are a unique public health care system. One of the strength of Tamil Nadu. That's why we have each level we have rapid response team. We integrate with other departments like animal husbandry as well as forest and fishery department and like our brotherhood departments like Director of Medical Education, Director of Medical Service. Recently, the Government of India instructed that to establish integrated health lab, public health lab. Even we have a plan to integrate the district public lab. One with the district public lab is established to detect the all common communicable disease. Now we are going to integrate because the lab should detect epidemic diseases as well as pathological. They are going to do pathological testing as well as histopathological examination. Likewise, they are doing the biochemical as well as hematological investigation. In a single hub, every district they have to going to establish on the integrated public health lab. Thereby, we are this is the time. This day we may make us to unite to fight against one health diseases. That's why we are integrated as a one. Thank you for me. We will opportunity.
Thank you, Dr. Sampath, for your insightful inputs. Finally, we invite Dr. M. Senthil Kumar, Senior Surveillance Officer, Director of Public Health and Preventive Medicine, Tamil Nadu. Dr. Senthil Kumar has been actively involved in surveillance, strengthening, and monitoring key public health indicators that inform policy decisions across the state. So please address the audience.
Good morning, all. Warm greetings from the state of Tamil Nadu, on behalf of the government of Tamil Nadu, the Director of Public and Preventive Medicine, and also wishes to all of us on this day of World One Health Day. As you all know, it is being celebrated on every year, November 3rd, to create awareness among the public as well as the stakeholders, and also to showcase our efforts towards One Health to the entire world that we are celebrating. And I'm really thankful to ICMR, RMRC, Sri Vijayapuram for organizing this workshop for the southern stakeholders One Health Day celebration here. And thankful to the director, RMRC, and also the special thanks to Dr. Muhanandam, who is always instrumental to supporting us for this activity. So, just coming to the slide, I'll just quickly run through it. What is that new initiatives being implemented in the state of Tamil Nadu? Next slide. Next slide. These are all the general things. Next slide. Next slide. We all know that common zoonotic disease issues will be the zoonotic diseases, vector-borne diseases, antimicrobial resistance, food safety and security, environmental health, and climate change. So our focus is on these areas. Next slide. So we have some gaps. So the gaps for the filling this gap only, this we are implementing this few pilot projects in the state. Just I will describe them one by one. Next slide. Yeah. As we all know that Center for One Health, NCDC, has already outlined that program, National Action Plan, under which National Rabies Control Program, National One Health Program for prevention and control of zoonosis, and Program for prevention and control of leptospirosis, as well as National Program for prevention and control of snakebite pneumonia. These are the listed programs under One Health activities by the Ministry of Health and Family Welfare, Government of India. So based on this, we are supposed to develop an action plan for regarding the rabies. So the state has already launched this state action plan for dog-related rabies elimination in the year September 2024 with an aim to reduce the zero deaths in the year 2030 as per the ministry guidelines. Next slide. So one more guidelines under this program, under one health program, is snakebite environment should be a notifiable disease. We are having one of the legacy of Tamil Nadu Public Health Act, which is enacted in 1939. So under which we have notified this snakebite envenoming as a notifiable disease. That is also one of the things being taken under the One Health initiative. Next slide. Yeah. So we published in Government Gazette also. Next slide. So this is on a new initiative. So we have developed two initiatives. One is One Health and Climate Change Strategic Committee. This comes under the chairmanship of the Chief Secretary of Government of Tamil Nadu, and the Secretary Environment, Forest and Climate Change will be the convener for this strategic committee, under which various departments like agriculture, animal husbandry, rural development, municipal administration, water supply department who are responsible for water supply as well as sanitation, and housing and urban development. We have included the chief conservator of forest, and we have included the commission of rural development as well as commission of mining and geology. And we have included NGOs, including MS Swaminathan Research Foundation. We have our director of public health is one of the nominee under the strategy committee, and we have included nominees from Zoological Survey of India as well as Wildlife Institute of India. And the director, Regional Meteorological Center, Chennai. So to focus on weather-related activities, he is also one of the part of that strategic committee. And UNICEF Tamil Nadu, WASH specialist also included in that committee. Totally overall 23 members were there. So to add this activities related to health activities, we have found a One Health and Climate Hub in the state with the support of the World Bank under Tamil Nadu Health System project. Next slide. Yeah. This is a One Health and Climate Change Hub. This the strategy committee was found in July. On November 24th, we have just found this Tamil Nadu One Health and Climate Change Hub. Next slide. Under which this secretary will be the chairman. The project director, Tamil Nadu Health System Reforms Project, he is an IAS officer. He is the member secretary and convener, and the mission director, National Health Mission, and all the directors. Director of Public Health, Director of Medical Education, Director of Medical Rural Services, primary, secondary, tertiary directors will be the members of this activity. Next slide. Yeah. So we are taking a few activities: wastewater surveillance and antimicrobial resistance. Director of Public Health has signed an MOU with SWASTI, the Catalyst NGO, for the wastewater surveillance and also the disease forecasting. So they are able to forecast the disease outbreak before 3 weeks of occurrence of the any like leptospirosis, scrub, or dengue, or whatever it may be. They are giving the early warning signals based on the climate change and other indicators. And then our One Health and Climate Change Hub, which is under the Tamil Nadu Health System project, they are also doing the environmental sampling and they are giving the highlights. Every month we are publishing a newsletter for this One Health and Climate Change Hub. Next year. So the one more initiative is that we have started typhoid and hepatitis A interventions in the Kadalur and Vilupuram districts. So we have intensified the surveillance. I think our SSO Pondicherry may know it. So we are after we started increasing the number of typhoid cases reported. Again, it's not a cancer. It is definitely useful Next slide. So as we know that the current system is single sector, the health sector only is involved. Since we have just formulated a district one health committee, now this is a multi-sector involvement. Health, environment, animal, water and sanitation, education department, everyone is involved in this activity. So instead of getting the clinical management and outbreak response, we have moved to the root cause elimination integrated prevention under one health. And this is earlier it was a vertical limited cross data. Now we are integrating real time and multi-sectoral data. So whatever the issues are happening, for example, animal husbandry department is reporting a leptospirosis or some other are happening. They are just informing us locally. It is not happening digitally, but it is happening over the email or other electronic data sharing, so that we can able to act and really identify the fever cases, and then we can go for the real time management of the diseases. So now this is commonly related cross sector driven program. Next slide. Yeah. So we have task force and coordination is there. Risk mapping was done. Then water and sanitation infrastructure was also strengthened, and we have promoted targeted campaigns in school, workplace, and community outreach for the vaccinations, surveillance of outbreak response, community engagement, capacity building, and continuous monitoring and review and adaptation was being carried out in this business. Next slide. Just before going to the challenges, just want to highlight one more point. So under this Government of India NCDC selected Tamil Nadu and Andhra Pradesh for piloting the One Health application. They are going to, they are already developed that application. So there's the mobile application, easy to use by the field investigators. So they have selected Ooty, the Nilgiris district, and Coimbatore. This is also both are literally all that are Ooty is fully predominantly mountain district. The Coimbatore has mountains as well as urban and rural and everything, it's a mixed population. So they selected this Coimbatore and Ooty as a pilot district, and we are in a strategic stakeholders meeting also. So this is being implemented in the state. And then one more thing is that to address the climate change issues related activities, we have developed a Tamil Nadu Green Climate Company. This is one of the first in the kind in India, not-for-profit company developed, initiated by the government of Tamil Nadu to address the climate change and climate change mediated diseases in the state. Along with Green Tamil Nadu Mission, Tamil Nadu Waste Tamil Nadu Wetland Mission, Tamil Nadu Climate Change Mission, Tamil Nadu Coastal Restoration Mission, Tamil Nadu Tea and Shore, that is also being implemented with this Tamil Nadu Green Climate Company. And then fifth one is, as I told you, that the World Bank is supporting that One Health and Climate Change activities of the Tamil Nadu Health System project. They have developed 5 DLAs. One is One Health Secretariat, establishing a exclusively One Health Secretariat at the state level. We have done it. The second thing is strengthening the existing labs, surveillance labs under the target of public health, because they are the first responders. So they are just being implemented, and also to integrate the data to a user-friendly platform. That is our aspiration, because there are various stakeholders are being involved, but the data are not real-time, not electronically captured. For example, the National Animal Disease Reporting System, there have been some data reporting mechanism, but it is not speaking with the IDSP. So both applications should speak to each other through an API, that is application process interface, so that we can swiftly act before the outbreak spreads to the community. So that is also one of our discussed leading indicator. Third one is capacity building for syndromic surveillance, and fourth one is strategy for prevention of antimicrobial resistance. This is under the wastewater surveillance. We are collecting the samples in various places as per the norms, and we are looking for that thing. And then we are planning for the antimicrobial resistance also. So even we are planning for the genomic sequencing of the E. coli. We have a world genomic sequencing lab at the State Public Health Lab, Chennai. So this was developed during the COVID time. Now we want to use this for other purpose also. So we are planning for genomic sequencing of the E. coli also. And then state level pandemic preparedness and response team, that is also one of the DLA, that is already there actually. State Emergency Operations Center SSO is functioning. So other than that, there is around the 5 DLAs which we are working on it. These are all the current status of One Health implemented in the state. Thanks for your patient listening. Thank you all.
Thank you, sir, for your valuable contribution and perspectives. For the next session on Puducherry's progress under the One Health framework, I am pleased to invite Dr. K. Vivekananda, State Surveillance Officer, Puducherry. Dr. Vivekananda has been a key figure in strengthening disease surveillance systems and fostering multi-sectoral coordination. Sir, we request you to share your address.
So, a very warm morning, and that was all the respected director, Nasim, respected consultant, and my different colleagues. And it's great. It is a matter of me to somewhere, and I think everybody is talking so much of theory. Can let us be interactive? Or I hope the students are also there. So, can anybody tell what is epidemiological trial? Sir, students. What is epidemiological trial? And somebody will tell me. So that's an agent host and environment. So environment is there. Now we are just delimiting. So without environment, without agent and without host, this is not happening. Now we are just separating and integrating again as one. That's the basic thing. Now we have put the environment as climatic change and vector agent as and vector what diseases and agent is our host and other animals. And this is animal is very animal. And we are in main stage in Puducherry. We have not started. I just give you a glimpse. I learned so much things from Tamil Nadu. We will hope to implement next year. So, you know, Puducherry is in the southern east Coromandel state. We have over four regions. One in Karaikal in Tamil Nadu, one in Andhra, that is Yanam, and another in Mayur in Kerala. Next slide. So we'll start the nursery. Next. Of late, due to extensive, we have disseminated the need for proper intimation of the dog bite cases. In 2002, the total number of bites, dog bites are 94, and out of it, 6% was category 3, which is an anti-rabies serum. Next. And in 2023, it is 99%, and only 1% of category bites. 24 and slightly increase is up to September. 89% and out of it, large percent are category 3. So we have made a point that frequent dissemination of the information to all the medical officers by frequent training by NCDC made them to early identification and refer the patient to the central general hospital there. Next. And we have also started this automatic. This is a very good implementation process. We did the community. It's backed up by the director. And this auto will go to all the new corners of Puducherry, now our districts also. And the response is very much high. And we usually distribute the packets. And the same is happening in all the CNC and PMP. Now it has and upgraded Ayushman Arogya Mandir. Next. 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 And this year, we thought of innovative and we wrote in the Department of Preventive Medicine and Architecture, one of the medical colleges in Puducherry. And the PhD students on the road trip and they meet the people and found out what are the basic myths which is there, and we tend to first off the myths next. Then we made an expert. My regular counsel Dr. Murali there. We called in the animal husbandry expert, and we called in the preventive medicine department, and we cleared all the myths which is there prevailing in the community by clearing off all the doors. And we took an initiative by giving the dissemination process to the people who are attending the ARV clinic in GH, because the sense of fear, the sense of uneasiness is also prevailing in the GH, because people think that ARV per se will lead to some kind of reaction. So we made a point that everything is crystal clear and transparency is maintained. And this is also happening in the women and child hospital also. And almost all the local channels frequently they telecasted the awareness video. Next. This is the local channel, local language. Next. We tend to tell what is the first aid to be given to the dog bitten cases. Next. That is clean, washing of the
Yes. Yes. First is clean washing of the dog bitten area with clean water. We insisted on this first aid in the field itself. Next. These are useful things. Next. And we arranged a competition also to find out what is the level of thinking in the student's mind, and we gave them prizes also. Next. Next. And for this is in the Government Veterinary College in Puducherry. We arranged the rabies campaign there. And next. Our Rajiv Gandhi Institute of Veterinary and Animal Sciences came up with an app which is very much useful for the lay person who can just intimate the bitten dog bite cases directly to the system. And this app was rolled out in last month by the Secretary of Animal Husbandry. Next. 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 And this is the current status. We have conducted training also. Next. And now we have started to implement the prevention and control of leptospirosis program. And this third 3 quarters, last quarter saw a drastic rise in the number of leptospirosis cases. Next. And scrub tables also in increase because we are giving service to neighboring 8 districts of Tamil Nadu, and we are all the 4 borderline medical colleges are having the cases from Tamil Nadu also. And climatic change is one of the important thing, and myself is also looking at the district model of the climate change. Next. And state level action plan and district level action plan has been formulated, and we are implementing it. Next. And we have exclusively set up a heat stop ward in the district hospital where you get first treatment. Next. And this is the first aid tray exclusively given for the heat stroke patient. There will be the thermometer, wet towel, stethoscope, and everything. And this pamphlet is also there, given in local languages, both in Telugu, Malayalam, and Tamil. Next. Next. And this we got review of the climatic scientific by the Central Vaccine Nemats, Dr. Gagan Sadiq. And previous slide. Both the places we are going for solar energy panels. The Rajiv Gandhi Women and Child Hospital, they are planning for entire switching of the entire electricity, going for solar energy panel, and CHC curriculum also we are going for the LED lights and solar energy panel. Next. Antimicrobial resistance this year, we thought that information should be grown because antimicrobial resistance causes so much of problem in the community. This we thought that we start from the general hospital because the persons who are working in general hospital, they will private practice, and the legitimate use of antimicrobials by the physician who are working in general hospital should be cleared up. So we started with the persons who are there in the general hospital. Next. And we asked them to know what their perception is, ask them to just make a poster and see what they are thinking, and we distribute the praise also. Another thing is infectious ward people and doctors there. We got government hospital HSTs, and they are initially before the antiviral resistance due to extensive use of levofloxacin, the monoresistant cases or the multitetraresistant were there. And we thought that we should sensitize the doctors working there, especially the respected physicians. And we took an initiative and asked them to be a part of this antiviral resistance program, and we sensitized them. And the same was happened in Rajiv Gandhi also. We entered team doctors, staff nurses, and the paramedics took a place that deliberate use of, rationalized use of antivirals should be there. I got a video because lack of time I am not going to it.
And our government's commitment was also clear. We took a rally, and Honorable Lieutenant Governor was there to track up the writing. And we got all the things in the print media also. Oh, I can only the Thank you.
Good morning to all. Another activity in Puducherry, mainly in the field investigation carried out, whenever the dog bite, cluster of dog bites is reported in the inner Puducherry region, with the help of municipality and animal department to catch the dog and kept for quarantine for 2 to 3 days. And after that, the dog died, then samples collected from a veterinary college student to testing for the rabies. So in positive cases, a reporter for the animal bite, so that people, the surrounding people, should give the anti-rabies vaccine, and also the wound category for category 3, some bite and burn, for giving the anti-serum also with the help of municipality and then animals department. And also the zoonotic cases reported for leptospira, spectacles also in the Puducherry region. So with the coordinated animals department and field investigation with the patches affected people to identify and source reductions also carried out for One Health activity, and also the veterinary college also coordinated for One Health activity. So both of in our Puducherry for One Health for collaboration of all the Puducherry health department and animals department and the municipality. So to control of all the main this program for leptospira and rabies program of the state. One more program is a snake bite program also functioning. So this year is implemented for the snake bite program. Then previously for prevention and control of rabies also conducted for all the program in the Puducherry, and our state also to launch for state action plan for prevention of rabies to prepare. And the next month also the animal birth control also conducted for our state for sterilization of stray dog and also pet dog. This is the main One Health activities in the Puducherry region we are conducted. Thank you.
Thank you, Dr. Vivekananda, for your enlightening remarks. Now we move on to the technical session 1, which is a panel discussion. We commemorated technical session 1 on challenges and way forward. This session will focus on identifying key hurdles in operationalizing the One Health approach, examining gaps in surveillance, capacity, coordination, and resource allocation, and exploring strategic pathways to strengthen multi-sectoral collaboration, research, integration, and policy framework. This discussion will also highlight opportunities